Okay, we'll begin then. When I set up in my own mind this program, it was principally designed for the new residents. We've had 22 or 23 new residents come in since last October. And I sent out a specific invitation to each and every one of them. And so far I see 2. So that's not a very good turnout for this particular thing. But I'll go through it anyway, and I'll go through it quickly because all of you have seen this material before, and it's really designed for the new people.
But we have short-term memory loss, so we forget that we've seen it.
The first thing I want to talk about is the File of Life emergency medical information put out by the San Diego Aging and Human Service Agency. And this is a refrigerator magnetized packet that contains a sheet for medical information, and it's in the back of these packets. And it's designed to be put on your refrigerator to be used either by you or your relatives or a person who might be taking you to the hospital or to the emergency room. And in the front of it, it gives information as to what to do when you call 911. First of all, you give your name and your phone number and the address of where you are and who you're calling for. Then you briefly describe the emergency and you wait on the line till the dispatcher hangs up. Now, in our situation here in Carlsbad by the Sea, the assisted living has a medical sheet on all of you. So if the 911 call goes through assisted living, that sheet will be pulled and given to the emergency medical personnel. However, I think this is of extreme value in case the assisted living personnel are not involved, or like for example, if you're traveling, this is an excellent thing to have in your baggage because it contains everything that the emergency room people need to know. And we'll very briefly go through that. This is a sheet that was designed by your health committee, revising the one from the San Diego County Aging Committee. That's okay, please. Just leave it. Close. This sheet, I'm going to briefly go through this, has your vital data, name, address, phone number, date of birth, married status, what your Medicare number is, what your secondary insurance number is, and the name of your secondary insurance company or your HMO. Now, if you have a California Advanced Healthcare Directive, it should be enclosed in this packet along with this sheet. Oftentimes, if they haul you off to the emergency room, you can't talk. You may be fainting, or maybe in a semi-coma, or you may be whatever, but you can't communicate. So this kind of sheet tells everything you need to know. And then next it comes the state, in case of an emergency, who to notify. It gives room for 2 places. Then religious affiliation, and a clergyman, if you so wish to put it down there with a phone number. The next paragraph is pet information. What do I do with the pet? Who's going to take care of it while you're gone? On the bottom, it's medical information, primary physician, hospital preference, medical record number. If you have a medical record number, you have a card with a number on it, that should be placed in here. There's also room for your dentist, your pharmacist, and your mortuary preference, if you should have one. The back of the sheet is food and drug allergies and past and medical surgical history. That's very important. Now, the one thing that is not on this sheet that ought to be on, and will be on next year, is if you have a particular family history. If you've got a history of a mother and aunt and a sister with breast cancer, that certainly should be on there. Same thing with diabetes, grandmother, mother, sister, aunt. That kind of information is extremely important to emergency personnel. And the next item is medical devices. Hearing aids, glasses, contact lenses, walker, scooter, oxygen, pacemaker, whatever you happen to have. And then finally, current medications, the name, the dose, and the reason that you're taking them. Now, every year, on the 1st of October, we pass out to every resident a covering letter and this form. And the information is only of use if it's current. So it's important that this be brought up to date. And while I'm mentioning that, I should also say to you that every couple of years, 3 years, 5 years, you ought to have your will reviewed, you ought to have your agent for medical care reviewed, and the same thing for financial agent. Things do change, they don't stay the same. We've been doing this now for 5 years. And so things do change, and we hope that people keep things current because that's what really makes it worthwhile. Now, any questions about this particular thing? None. Okay. We'll move on. The next thing I want to talk about is influenza. And I passed out to you 2 sheets of paper, which we'll cover in a moment. Now, what about influenza? What is it? It's a viral disease. And there are 3 kinds of influenza, A, B, and C. Now, influenza A is the most common one and is the one in which mutations often occur so that it is necessary to change the composition of the influenza vaccine every year. And how that is done is the CDC in Atlanta looks at the previous year's experience and then decides what to put into the current year vaccine. And this year, the current vaccine contains 3. There's an influenza A California, which is the same as the swine bird flu that we had in 2009, 2010, where we were required at that time to have 2 shots, because by the time they identified what the strain was, they had to make another vaccine. Now, the current vaccine contains the H1N1, and it's A California. There's another A, which is H3N2 Victoria, and finally a B strain, which is B Wisconsin. Now, I want you to take a look at this chart that I gave you. Often the question is asked, when should I get the vaccine injection? And the answer is, in my opinion, the answer is in October, either the latter half of October or the first part of November. Now, if you look at this chart in front of you, this is a chart from last year, 2011, 2012. Starts in October of 2011, runs through May of 2012. And if you look at it, you'll see that the peak of infection in the United States was in March. Now, the vaccine that you get takes about a month to develop immunity. And then the effect of it wanes beyond that. And that's why you have to have an injection every year. Well, if you look at this one in March and say, well, gee, I don't want to get this in October. It'll be on its way down by the time we get to March. But the problem is you have to know that the last time this chart looked like this was 1987, 1988, which is 25 years ago. It usually, in California at least, we usually hit the peak around Christmas time. And the latter half of December, the first part of January. So again, the time to get the vaccine is October, early November. I think it's a little early, but you're going to see on the TV, and you're going to see mailings from your insurance people to get the vaccine now. Well, you can get it now if you want, but I think a little later would be better if you can understand this graph. The clear boxes are the H1N1, And the darker boxes down below are the H3N2 and the B vaccine. The B incidence of influenza is the very dark on the bottom, which has very little incidence. Any questions about this, the vaccine itself? What's in it, when to get it, how long it lasts? Now, obviously, if we would have a peak of influenza cases next year, in March or April or even in May, you could always get a second injection if it looked like it was going to, and the public health people would be telling you that. Now, what is the flu? The flu is a respiratory disease. It's contagious and it spreads easily from person to person by droplets in the air, by coughing, by sneezing, and from contact from exposed hands to the eyes, nose, or mouth. Now, the flu virus cannot be absorbed through the skin. It has to come in through one of the orifices. And this is the reason why I gave you the second sheet, which is advice as to how to protect yourself and your spouse and your community. If it's contacted by droplets in the air and you're sitting next to somebody who's sneezing or coughing, then you've got a good chance of picking it up. But it is more often picked up from the hands to the mouth or nose or eyes. So cover your mouth with a disposable tissue. Handkerchiefs and napkins or other washable cloths I don't think should be used, especially when you think that you're sick. Now, some people suggest coughing into your arm. I think that's not a good idea because of the contamination of the clothing. I think the best thing to do is use tissues. Now, wash your hands frequently with soap and hot water, especially after you sneeze or cough. Use a hand disinfectant. I'm very unhappy, disappointed, and sad to see the use of the hand disinfectant in the dining room not being used by very many people. Obviously, we don't have a problem now, but later on in the flu season, we may have a problem. And if you just think for a moment about the salad bar and the tongs, about 50 people use the salad bar every day at noon, and maybe 70 or 80 in the evening. And so that many people are touching the tongs, which you are picking up to pick up your food. If somebody, a server or any other person, would come around and pick up your glass of water by the rim and move it, I don't think that you would want to drink from that glass. But we have all these people using the tongs, and we don't think for a moment about what they may be carrying around on their hands. And of course, it goes without saying you don't stick your hand in the bread bun and pull out a bun. You use the tongs. So I would urge you to rethink the use of the hand disinfectant in the dining room. You must avoid touching your eyes, nose, or mouth because, as I said, the viruses don't pass through the skin, but they gain entrance from these orifices. Avoid close contact with sick people. If you have to be close, you should consider the use of a face mask and disposable gloves. This goes for a husband or wife who's taking care of the spouse. If you have the flu symptoms, stay home. And you should stay home for 5 to 7 days. You probably could go out 24 hours after the fever goes down. It would be best for everybody in the community if you stayed home for 7 days. And you can order your meals with takeout. Any questions about basic health habits?
I have one.
Yeah.
We have that little jar of glue that we're supposed to put on our hands before we touch those things. Is that effective?
Yes, yes, hand disinfectant is
Yeah.
very effective. In a hospital, for example, the nurse is supposed to disinfect her hands before she enters each and every room that she goes into. And it's widely used in medical circumstances. And we fought hard to get the thing. They put it in not the best place, but it is there if you're aware of it, and it should be used. Now Mary is a little smarter than I am, because I use the hand disinfectant before I go to the salad bar. But Mary's being smart and knowing about the tongs, uses the hand disinfectant after she uses the tongs. Because that protects her from whatever might be on the tongs. And if you just sit there and look once in a while, you see very few people. Okay.
Does it transfer to the food?
It would have to be, you'd have to sneeze right on the food. Sneeze or cough on the food. And the way it's protected there, that would be less likely, but obviously possible. Yes. All right. Any other questions about that?